Hello everyone, welcome to sqadia.com and let's start with our section 1 of the lecture topic Malignant Disease of the Ovary. In this we will go over the introduction of the ovarian cancer, then what's the pathology and risk factors associated with the ovarian cancer, and what are different screening tests and preventing measures taken for the ovarian carcinoma. So, introduction: ovarian carcinoma is a malignant disease, a very common malignancy in the females, and it spread very rapidly. And at the time, usually when the ovarian cancer is diagnosed, usually it's already widespread. So prognosis with the ovarian cancer is not very good. So it's rapidly progressing, very threatening, and result in the death within very short time. Ovarian cancer is a type of cancer that begins mainly in the ovaries. So starting primary is in the ovary and then spread rapidly, and it's a malignant disease, spread rapidly to the other organs and rapidly cause death. It is the second most common gynecological malignancy in females, so it's very, very common. Major cause of death in women. So ovarian cancer causes death in females because it spread very rapidly, and by the time it is diagnosed, usually it's already very late. In general population, the risk of developing ovarian cancer is about 1.4%, which is about 1 in every 70 women. And the mean age of presentation of ovarian cancer is about 64 years of age. It is more common in white females than in other races or as compared to Asians. So white women are more prone to develop ovarian cancer. So it's the second most common cause of malignancy. Mean age of presentation is about 64 years, and it's 1 in 70 females get the ovarian cancer. White are more commonly affected by this. Hereditary also plays role in the ovarian cancer. So genetically, genetics play an important role in the ovarian malignancy. An hereditary or genetic type of ovarian cancer occurs in two forms. One is hereditary breast ovarian cancer, and the other type is hereditary non-polyposis colorectal cancer, non-polyposis, in which we don't have any polyps form in the colorectal. So in this, it's a non-polyposis type. So two forms of hereditary ovarian cancers. One is with breast cancer and the other is with colorectal cancer, non-polyposis colorectal cancer. Now, what is the pathology of ovarian malignancy? Pathology means abnormality. So at the cellular level, what are the different forms of the ovarian cancer or ovarian malignancy? It is pathologically divided into two types mainly. One is primary, which is 80% of ovarian cancers are primary, and about 20% are secondary. Primary, they originate in the ovary and then spread to another areas. In secondary, it is involved secondarily. Besides the main tumor or main cancer originate in the other organs. So the primary is the main ovarian cancer. 80% is primary, and the two types main of primary ovarian cancer is epithelial and non-epithelial. Epithelial again is very common. About 80 to 90% of primary ovarian carcinomas are epithelial, and only 10% or so is non-epithelial. Out of the epithelial type, we have very common, most common is serous, which is about 60%. Mucinous is 20%. Endometrioid is 2%. Brenner and undifferentiated, they are very, very, rare, not very common, but the most common epithelial tumor is the serous type, in which there is clear fluid is involved. Serous is clear fluid. And then we have 20% mucinous, and then endometrioid. Endometrium is the lining of the uterus that is also involved. Brenner and undifferentiated, in which there is no differentiation of these cells. What are the prominent cells in that? And non-epithelial again is divided into three types. We have in the non-epithelial, most common is germ cell. Germ cell tumor is about 10 to 20%. Sex cord-stromal is about 3 to 5%. And then unclassified, like undifferentiated, in which cells are not fully differentiated or recognized. Unclassified, it's not classified completely, so it is labeled as unclassified. Then secondary type, which is about 20% of ovarian cancer, we have two types, typical and atypical. So typical and atypical are the secondary. Primary divided into epithelial, which is most of the cases, about 80%, and non-epithelial, which is about 10 to 20%. So this is the broad pathological classification of the ovarian malignancy. Again, now the primary epithelial tumor. We already know that primary epithelial tumor is one of the most common type of ovarian malignancy, which is about 80% of the ovarian malignancy. It is divided again into cystic type and solid type. Cystic are fluid-filled sac. It's not solid, it has fluid inside. So that's the basic classification of the epithelial tumor. One is cystic, which has fluid-filled sacs, and then one is solid, which has no cavity or no sac. Type of tumor, epithelial one is we have serous, and serous are the most common. We already went over that. And then the second most common is the mucinous type. So type of tumor under the cyst, we have serous cyst carcinoma, in which the cysts have the clear fluid. Mucinous cyst carcinoma, which is thick mucus type. Mucinous is not clear. Then we have malignant dermoid type of carcinoma, and then endometrioid or adenocanthoma. Adeno is the term used for the glands. So it's basically in this, it is involvement of the glands of the endometrium, endometrioid or adenocanthoma. If you see the histologic picture is when under the microscope you see what is the prominent picture. Histology means the study of the cell or tissues. So under the microscope, which are the prominent tissues involved in this? In serous cyst carcinoma, mainly the tissue is adenocarcinoma. Again, adeno is the gland, so it's the glandular tissues are involved. Again, in mucinous type, again, adenocarcinoma on histologic picture. In malignant dermoid type, there is squamous cell carcinoma. Squamous cell are involved in this type. And then in endometrioid or adenocanthoma, also it's adenocarcinoma. So if you see, so histologic picture mainly in the primary epithelial tumor is adenocarcinoma type. So mainly it involves the gland, and whenever the glands are involved, usually we have different secretions are present, like serous type of secretions and mucinous secretions. So this is the broad classification of the primary epithelial tumors, which include cystic type and the solid type. Now, some risk factors of ovarian cancer. Some causes which decrease the chances or decrease the risk of ovarian cancers, some factors are multiparity. Female who have multiple gestations, they are at decreased risk of developing ovarian cancer. So having multiple births is decreased the risk of ovarian cancer. Whoever is taking combined oral contraceptive pills, which is the pills used for contraception, combined hormonal pills, they also decrease the risk of ovarian cancer. Similarly, females who went through tubal ligation, salpingectomy. Salpingectomy is the removal of the fallopian tube. Ectomy is removal. Salpinge is used for fallopian tube, so removal of the fallopian tube. After salpingectomy, also the risk of ovarian cancer is decreased. Similarly, hysterectomy, which is the removal of the uterus, risk of ovarian cancer is also decreased. Some factors that increase the risk of ovarian cancer is nulliparity. Nulliparity is the females who never give birth. Intrauterine devices, IUDs, used for birth control also cause increased risk of ovarian cancer. Similarly, endometriosis. Endometriosis is the condition in which endometrium, which is the lining of the uterus, is present in areas other than the uterus, outside the uterus. It also increases the chances of ovarian cancer. Similarly, females who smoke cigarettes, there is increased chance, and obesity is also the factor for causing increased ovarian cancer. Then there are also some genetic factors that leads to increased risk of ovarian cancer, which is mutations in BRCA1 and BRCA2. These are the genes in which if there is mutation or changes occur in these, that can lead to ovarian cancer, especially the breast ovarian carcinoma. And Lynch syndrome is the non-polyposis colorectal carcinoma. So these are related to genetic predisposition. So if genetic factors like these, any mutations in BRCA1 and 2 leads to ovarian cancer. So most common hereditary cancer is the breast ovarian cancer, and then mutation. Mostly these are due to mutation in BRCA1 and BRCA2. So these are some common factors that leads to increased risk of ovarian carcinoma or ovarian cancer. Now, what are the screening and preventing ovarian cancer? How we can prevent or how we can screen for the ovarian cancer? Screening is mainly by the transvaginal ultrasound, if sometimes on routine or sometimes as a normal part of the screening test, it is diagnosed on transvaginal ultrasound. Other important screening test for ovarian cancer is CA125 measurement. This is the malignancy marker. So tumor marker, it is increased in case of the ovarian cancer. So it's very important diagnostic screening test for the ovarian cancer. So how we can prevent by the risk is reduced by prophylactic. BSO is bilateral salpingo-oophorectomy. So prophylactically, if there is removal of both sides fallopian tube and ovaries, this can prevent or decrease the chances of ovarian cancer. Then bilateral salpingectomy, which is only the removal of fallopian tube, and later on the ovaries are also removed with delayed oophorectomy. Tubal ligation, in which tubes are tied, hysterectomy, removal of fallopian tube, and combined oral contraceptive pills. If you see, these are the same factors again when we talk, which are the different factors that decrease the chances of ovarian cancer. So if these can be performed on time or prophylactically, they can decrease the chance of getting ovarian cancer. So that was all about section 1, in which we talk about what is ovarian cancer, how common it is, what is the pathology, and how it presents under the microscope, histological features, and what are the different screening tests and how it is prevented. Thank you for watching sqadia.com.